thing that we also do at LREB is to promote sharing ideas in between. That means that whatever Bungoma is doing, basically in cervical cancer currently, we would want to see it in Homa Bay County. We would want to see it in Siaya County. We would want to see it in Busia County. So the best we would do is to pick these ideas and share with our members within the region itself. So our major thing is just to coordinate activities within LREB itself. So that is basically what we do at LREB. Another thing is that at LREB, we, apart from coordinating activities, we run different programs in between. And one of the programs that we've run for a very long period of time is cervical cancer. Cancer Day. Today's Cancer Awareness. Are you with me? Mko na mimi? Huko kwetu tunatoka Kiswahili na tuvunja mimi. So I cannot speak in Kiswahili. I'm very sorry about that. But I'll try to speak in English as much as I can. So what I was saying is that we've been promoting different ideas. One of them is cervical cancer. So cervical cancer, we've had meetings. The first meeting that we had was held in Kisumu, I think 2 weeks ago, in it's called JOTRH. That is the referral hospital within Kisumu itself. And then the second one was held in Migori, and the representative is here. She'll talk about that in details. And basically what we're doing is to try and create awareness when it comes to cervical cancer. We want cervical cancer to be something on the past at the end of the day. What they say in Kenya is that, and that I don't lie, in Kenya we have 9 women dying out of cervical cancer every day. So that means that within our region itself, we have a population of around 16 million. And this 16 million accounts for a third of the population in Kenya. So that means that within LREB itself, we are losing 3 women per day. Is that a small number? Is it a small number? Imagine losing 3 women who have children, who have husbands, who have a family to run. Maybe some of them are breadwinners within their families. Yet at the end of the day, this is a cancer that we can prevent and control by use of small means, screening, treatment, and then what? Vaccination for our children at the end of the day. So why don't we push for this at the end of the day? We want to encourage the health workers kindly let us be at the front line so that we push for this agenda of cervical cancer within the region itself. We want more people to be tested. One thing I'm proud of is I teach in some of the schools. I always find a way of bringing cancer into it. Because what I saw in Kisumu and what I saw from the survivor of cancer in Kisumu tells me a lot about cancer. So I'll have to find a way of connoting it and making sure that all those students, apparently I teach so many female students, I make sure that they, at the end of the day, before the semester ends or the term ends, I'll ask them if they've gone for screening for cancer. I would want to see that at the end of the day, they also see the importance of doing cervical cancer screening. Because once it is identified, treatment occurs easily. But when it goes to those other later stages, then as per the statistics, 50% of the women who reach that level are not able to survive cancer itself. So it kills. And one thing that I'm scared of, maybe one day I might be told, is that you have cancer. I don't know how people react to that. I wish one survivor one day will tell us how they reacted to I have cancer. Is it something easy? Is it a journey that is easy to lead? Yet we can control it within LREB itself. So let us work towards that at the end of the day so that we find ways of controlling it. Another intervention that I would want to talk about briefly is about the health, is about the church leaders, religious leaders. There was a time HPV vaccine was brought to the country, and there was a lot of fight among religious leaders on where the uptake of the vaccine itself. And the fight was that if you give our girls this vaccine, you are giving them a license to go and do what? And have sex. Was that the discussion? Yeah? I had it in our country itself. So they were not encouraging cancer vaccination at the end of the day. But apparently, currently, everything is okay. And I think they came to terms with the fact that we can control vaccines within the country. We can target the religious leaders. Let them talk about this particular issue in their churches because they meet so many women and so many children at the end of the day within their churches. Let them talk about it. Let us promote cervical cancer at the end of the day. Otherwise, I appreciate this opportunity that I've been given. And I believe at the end of the day, we will be able to fight cervical cancer. Thank you very much, very much.
Thank you very much. I also like to invite Dr. Dan Ogola, who's from Matibabu Foundation. He will confirm if it is a foundation or an organization. Yeah, so this is the team that has dressed us beautifully today. So let him also say something.
Excellency, the Governor of Bungoma, to your host, Lady of Bungoma, Dr. Lusaka, to your Excellencies, County First Ladies from various counties within the Lake Region Economic Bloc, to your Excellency, the second county lady from Migori. It is a pleasure to be here with you, and to start this, I would like to introduce myself. I'm Dan Ogola, who was privileged to start health issues when I was about 7 years old, and I have been crying for a region, that is the Lake Region Block. And in 2021, we managed to meet with the owners of figs that are based in California, and they were willing to give us the medical scrubs to encourage the healthcare providers to initiate a discussion with the patient about matters cancer of the cervix. And we have also, I don't know whether it has been mentioned, we usually conduct virtual meetings by all the today they are not here, they're in Nairobi. But this is a continuous process. We have the meeting every Thursday. We have also looked in the University of North Carolina, Chapel Hill, and they have donated to us a professor who comes from this region, within the Lake region, Professor Chemutai Mungo, who helps the providers in the evidence-based medicine. And that is a process that is ongoing. UNC Chapel Hill, together with Matibabu, are also conducting a research on how we can use technology to improve the quality of care. Having said that, there's a progress that we are making. And where there is a progress, there is hope. Do we have hope as people from LREP? Do we have hope? When people unite, when communities rally around the vulnerable, and when individuals innovate and collaborate across borders, change is within reach. The elimination of the cancer of the cervix, right from the media house to community health workers that play a major role in bringing care closer to people. these are ways that we can go about involving ourselves in the elimination. One is by educating the public about cancer prevention. The second thing is by equipping healthcare professionals with skills and knowledge. And the third is by strengthening the primary healthcare, which according to this country, the government has given us a guideline. It is called Primary Healthcare Network, and Bungoma County is doing pretty well in forming the PCNs. Then the other thing is by addressing the policy matters and programs. Having said that, I would want to inform the meeting here that I'm humbled to donate 1,000 medical scrubs to Bungoma County. And I will be doing this not only from Sierra County, where I come from, but to all the LREB counties, the 14 of them. The next part, if I'm allowed, I wanted to invite the LREB health lead, Mr. Ochieng Gumbo, to help me recognize the people who participated in the competition within the Lake Region Economic Bloc. The competition was started in 2021 towards December. And so I can say it effectively started working from January to December 2022. And the areas that we were looking at was one, HPV vaccination, screening, and finally treatment. I must tell you that Bungoma did so well in terms of HPV vaccination. And all the counties that excelled in either vaccination, screening, and treatment, as Matibabu Foundation, we decided to not only give them the certificate, but give them something that will also help them with evidence-based medication or medicine. And may I now take the opportunity to be supported by Ochieng Gumbo, the LREB health lead, to issue the certificates to people who did well. In carrying this activity, Maseno University, a neutral entity, was charged with the evaluation. And so we had the following. In terms of so we have a certificate to Bungoma County for being the best HPV vaccination in LREB 2022. We should be guided to know who should receive it. It's not just the paper. We will also give them the colposcope machine for cervical examination, for the examination of the cervix. The machines are yet to arrive. There's one of our sister organization in California is bringing it in March, and we'll inform the county first lady so that we can present it to you. The second certificate goes to, I think it's The next certificate during that competition on the treatment was Kisumu, and so we have a certificate for Kisumu County for being the best in cervical cancer treatment in LREB 2022. I was of the opinion that I've been working with the county first ladies. I would want them to help me give you this. For the host county first lady, would you kindly help me? Thank you so much. And for the screening, as I mentioned, is vaccination, screening, and treatment. The screening was also led by the Kisumu. So may I request another county, the chair for the LREB region, the county first lady that chairs it within the Lake Region Economic Bloc, to help me award this certificate for screening to Kisumu. Thank you. Thank you so much. The second best in screening within the Lake Region Economic Bloc 2022 for the competition was none other than, who want to guess? If you guess, I'll give you the, if you guess, I'll give you the scrub. Which one? Okay, it's our opportunity to issue the second best in cervical cancer screening in LREB 2022 competition, and the certificate is awarded to Migori County. Do we have anybody from Migori other than the county first lady who accompanied the... Yeah, so may I have, with your permission, may I have the county first lady for Migori and the county second lady of Migori to receive this, and this will be given by the deputy county governor for Bungoma. Allow me, please. Do you want to say something now that you're the only one who are here? Do you want to say something? Do you want to say something? Okay, thank you. Thank you so much. Migori is most likely to win next time when we organize this. So there will be a nice competition between Bungoma and Migori. For the HPV vaccination competition LREB 2022, who do you guess would be having this? Bungoma was number one. Okay. The vaccination, I would want, this is serious business. It's county ladies taking the certificates. I would appreciate the waziri and the county government, the deputy governor, to receive your neighbor. My wife also comes from Kakamega. So the two of you can receive the waziri and the deputy. Help me to issue, yeah? Yeah. Give the document to our county first lady of Kakamega. Yes. The second. No, I think. On HPV vaccination, we also issued to the third best, and on HPV vaccination, third best during competition was Kisii County. Do we have somebody from Kisii County? Any representative from Kisii? Any representative from Kisii? We will give this to LREP and we'll take it to Kisii County. We also have third best in cervical cancer screening, and this is from Siaya County. I think the host, the county first lady that is hosting us, can give it to you, please. Bungoma County did so well in HPV vaccination, and they will be doing better in the treatment. I know I talked to the lady who is in charge of primary health care, and she told me that they have launched, I think, about 11 PCN, primary healthcare network, and we have also rewarded them for being the third best in cervical cancer treatment. They will be leading the entire LREB region in both HPV vaccination and screening and treatment, because they have set a system. So may I request, do I request the medical superintendent and this be given by the host county first lady, or do I request the county first lady for Migori to help me give this to the medical superintendent? I think Migori suits the bill.
It makes us feel jealousy, so we will work hard.
Bob Colimo, CEO wa Safaricom.
Again, it's with a lot of humility that I thank all of you for giving us, as Matibabu Foundation, an opportunity to work with you. I want just to promise you that we have a nursing college, Marianne Van Damme School of Nursing, that is connected to San Francisco State University. And we want to bring quality in healthcare training, pre-service training. And so if you have people from Bungoma that wants to come for training, Matibabu Foundation will give them 10% discount if they pass through the county first lady of Bungoma. Thank you so much.
Thank you, Daktari, for giving us so much good news. I don't know if we have appreciated you enough. Is this the best we can do, Bungoma? Yeah, so let us give Daktari and Matibabu Foundation a good clap. Let's give him showers. Do you know how to do the showers? Showers in claps. Until I say stop. Thank you very much. That's good enough. Thank you. Yeah, at this juncture, I want to invite Dr. George Odumbe. He's the representative of Africa Cancer Foundation, where the First Lady of Kisumu, Mrs. Dorothy Nyong'o, is the chair. So he'll be representing the foundation as well as Mrs. Nyong'o. Thank you. Dr. Odumbe.
To the First Lady Bungoma County, who is our host. Doing the screenings. So we do the Viavili, we also do the education, and then currently we are also treating precancerous lesions. So it's a good thing, and I'm glad that all our organizers are here, Matibabu, and all the other organizations. And I hope that we are going to work together. Teamwork beats any day. So I hope we're going to work together to try and reduce this prevalence.
Thank you very much. We want to rush the program a bit. We really appreciate everyone who has contributed to this day, all our partners. We also have local partners, Dumisha Afia, who was appreciated earlier on. We really appreciate the support you've given us in terms of to ask how many of us have been vaccinated. But I'll ask it so that you don't raise your hand, but you answer silently. Sindio? Yeah, kindly let us be screened and let us be champions. Let us make sure everyone is being screened. At this point, I want to invite Waziri to take on the next program.
Thank you so much, Dr. Emma. The First Lady Bungoma County, Dr. Margaret Lusaka. The First Lady of Nyamira County, Emily Nyaribo. First Lady of Kericho, Betty Mutai. First Lady of Kakamega County, Janet Baraza. First Lady of Migori, Madam Agnes Ochilo. And the Second Lady of Migori, Madam Evelyn. Our MCAs who are here, CECs, I'm seeing my colleague, CEC Gender, receive the apologies of CEC from Kericho, Honorable Edna. She was on the way, then her car broke down. The county commissioner's representative was just arrived. Apologies from my chief officer, who is engaged in another function. Apologies from my director, who is also another function. The CHMT members who are here, Director Education, partners who are here, sub-county teams, CHAS, CHUS, CHVs. Bwana asifiwe. Asifiwe tena. Before I put in a word, I want to recognize the presence of A1 or A1. A01. Aruja tuambie ni kitu gani. Actually, she's the representative of the county commissioner, Bungoma County. Madam, come and greet these people and make a few remarks.
Thank you so much, Waziri. First ladies present, county directors present, the health fraternity at large, media, the different you here, partners that are here. Good afternoon. My name is Christine Wafula Chacha. I'm the AO1, as Waziri is trying to say, that is Administrative Officer 1. I deputize the county commissioner. So that is my post, or senior assistant. My designation is senior assistant county commissioner. So this is a very important day for us. Cancer is one of the illnesses or diseases that has really come up, and it is a killer disease. It is something that comes in so silently. So I would urge all of us, because in one way or another we either have sisters, we have mothers, we have daughters, and we know that when there's early diagnosis, then we can be able to take care of it. So we urge all of us that we keep doing it. I know we do it, some do it, and what is important is that we do it regularly, so that we can do the testing regularly. We check ourselves. Most of us have covers, but you will discover that even with the medical covers, we rarely go for the full body checkup. I encourage all of us, be it men, be it women, to go for checkup at least once a year, so that we can be able to diagnose most of these diseases early enough for interventions to be taken. So thank you so much for all. And I just want to welcome our visitors to Bungoma County. Welcome so much. Feel at home as we continue interacting. And I know you've come with goodies for us as a county. You've come with even good words. So karibuni sana. Thank you so much. And I know you are wondering maybe why I came at this time, but I was held up in another function in Bungoma. So it is not like I didn't take this seriously, but I thought it would take a shorter time, and here it took some time. So, but here I am, ready to also learn, ready to listen, ready to know what is going on, so that I can disseminate to the other ACCs, to the other chiefs, to the other assistant chiefs, and everyone, so that they can also tell the community, because as we are here, we are not all of us here. So I will do this on their behalf, so that I can give back the information to them and the other wananchi at large. Thank you.
Let's appreciate her better. At this moment, I want to request the CC for gender to come forward and make her remarks. Karibu.
Asante sana waziri wetu wa afya, our deputy governor, our first lady, most beautiful one, all the other first ladies, all protocol observed. Good afternoon. Mimi naitwa Nancy Nanyama Kibaba, kwa wale ambao hawanijui, ndio mwakilishi katika Wizara ya Gender, Culture, Youth and Sports. Kuna jambo ambalo limenishangaza ile wakati nimekuwa naangalia our first ladies kutoka kwa the other counties wote, na nikagundua kitu moja, possible nende chisura chindai. Nono kali ewo musecha nona mwo musahulu no wenye obeho governor in future chungo mkhasi wa obule mwaulile, ili akikuwa anang'ara pia wewe ukiomba kura utapewa, lakini kama umeacha anakaa hivi hivi ukiomba utanyimwa. Namwe mimi ninataka nishukuru. When I had one of the survivors akipeana hapa brief, nikaona huyu Sasaka akishtuka sana, vile walisema ati ilibidi afanyiwe atolewe moja, na Sasaka akashtuka sana. So I think it was an important learning experience. Usijali, hata mimi nilistuka. And I think moving forward, we have now the courage to also participate in these tests. Leo, Your Excellencies, nimekaa next na Daktari Emma, and the unfortunate bit is she kept asking me, have you been screened? Have you been screened? I think next time, Daktari, when I come, please make me to sit next to someone who is not a doctor, so that I'm not asked so many questions. But I want to promise that, Your Excellencies, within the next 2 weeks, I'm going to gather enough confidence to go and do screening. Nimepeana 2 weeks. 2 weeks, I think, nitakuwa nimegather enough courage. But otherwise, I want to register our commitment as County Government of Bungoma. You see our Deputy Governor is here. And as the ladies in the County Government of Bungoma, we will work hand in hand to make sure tunawapatia all the support that you require ili muweze kufanyia watu wetu wa Bungoma kazi. Na tunashukuru sana our community health workers. You know that our governor is very committed to working with you kuhakikisha kwamba mnapata the power na nguvu ya kuweza kufanyia watu kazi, si ndio? Muve nendenda lenda hii in 2 weeks, mniombe Mungu anipatie courage pia mimi nifanye hizi vitu sawa sawa. Ai.
Makofi kwa waziri. Thank you so much. My name is Dr. Andrew Amalwa, being the CC Health and Sanitation, Bungoma County. First, I want to appreciate our First Lady, Bungoma County, and the First Ladies from the neighboring counties in EREB for taking the initiative to create awareness on the screening of cervical cancer. I want to say that cervical cancer is 90% preventable. And in the prevention model, we have 5 steps. The first step is creating awareness. And this is what the First Ladies are doing. We really appreciate you for championing this. You know that breast cancer is the most commonest cancer among women. And the way to screen, the first step starts with the woman herself. That is self-breast examination. Wangapi, kina mama, wangapi wamejiguza matiti before? Unacho uguzwa na nani? Now, if you are sitting next to a lady, ask her, have you been screened for cervical cancer? If you are sitting next to a lady, ask her, have you been screened for cervical cancer? Yeah. Asante sana. And Waziri Gender, rightly so, you are sitting next to a doctor and she asked you. I was sitting next to the DG and I asked her. And she told me she has been screened. DG, we congratulate you from leading from the front. We want to encourage all mothers who are here. I'm sure you have either a sister, a friend, a daughter. Kindly let them get screened. In the prevention model, screening is the secondary level of prevention. And this is just basically to detect early cancer. This, it means we cannot afford to fail our population on primordial prevention, primary prevention, and then we only catch them at the secondary prevention. So I want to encourage First Ladies from here that you go forward and get more awareness for screening breast cancer, for screening cervical cancer. And as healthcare workers, you know the best method of primary prevention is vaccination. And Bungoma County is leading from the front. We are giving enough HPV vaccine. We want to congratulate our healthcare workers for mobilizing, sensitizing, and immunizing our girls who are between 10 and 14. The Ministry of Education, you are a very key partner in this. And I'm going to propose, just as we require girls joining Form 1 to test for pregnancy, can we also require them to be given HPV vaccine before they join? Because most of them are within the age of 10 to 14. With this, we are able to catch many before sexual debut. My side, as Waziri wa Afya, we are going to ensure that we train more staff who are going to do screening for women. As you heard, we only have 192 trained staff on cancer screening. We are going to ensure that we train many and many healthcare workers so they're able to screen people even at the dispensary level. I want to appreciate Matibabu and other partners for supporting us in the screening for cancer. More specifically, Matibabu for ensuring this day is colorful, as you can see people being donning in scrubs, including the first ladies. Utafikiri wote ni madaktari. Kumbe. We really appreciate, and more so for promising us that we are going to bring a colposcope to help us screen and treat our women. Makofi kwa Matibabu. Bungoma County is committed in facelifting and uplifting all healthcare facilities. We don't want you people to move from one facility to another looking for a service that can be offered where you are. Our governor is very committed, together with the deputy governor, to provide primary health care to our people. In this, already yesterday, we confirmed 179 staff who are working on contract to permanent and pensionable. To some people, it looks like ni jambo la kawaida. But to people who understand health, this is a big milestone. Because most of them, their contracts were coming to an end very soon. Some of them had already expired, and they were asking, what next? If we lose this manpower, where shall we get another? These are people who have worked in our health facilities. They have been trained, they have been capacity built, and therefore we could not afford to lose them. So the governor worked tirelessly to ensure that we retain them, and likewise, we are going to retain all UHC staff who are here. We are going to improve our healthcare facilities. We're going to upgrade at least every dispensary in a ward to be a health center, so that we have 45 health centers in Bungoma County. And also, the governor has identified a partner who is going to install oxygen plants in a few facilities in Bungoma County. Webuye is one of the beneficiaries. And this work is going to start anytime this month. Already the partners come on the ground. We have drawn the MOUs, so we are embarking on the training and then implementation. We're in the process of securing a pathology lab for Bungoma, so that you had one survivor saying they went to, a sample was taken to MTRH, then the results came back. We want, going forward, that Bungoma will be self-reliant in diagnosis and treatment of cancer. And lastly, before I finish, I want to encourage all care workers to be screened. Let's not give what we can't eat. Hata ukienda kama mapima, akisava anaonja kidogo. Si ndio? Nyi pia muonje hii kitu ngine. Sina sawa sawa. We want to encourage all of you to get screened. Not only for cervical cancer, but all cancers and all non-communicable diseases. You know that cancer works hand in hand with HIV. Bungoma is one of the counties that is endemic to HIV. So as we are creating awareness for screening for cancer, let's create awareness for screening for HIV as well. And with those many, many remarks, it's my pleasure now to invite, if there's any county member of county assembly who is around. Iko MCA yote hapa? Alikuwa lakini akatoka. Apologies